Before we leave you this week, our capital correction goes to State Senator Darren Bailey. We caught up with him in Effingham on Monday earlier this week. You may recall back in May when he was in the House of Representatives kicked him off the floor of the Bank of Springfield Center because he refused to wear a mask when he was at work with his colleagues in close quarters. But even now, these many months later, Senator Bailey still questions whether or not a mask works to stop the spread or slow the spread of the coronavirus.
There are businesses that haven't worn the mask and therefore haven't seen the, the problem of a massive spread. As a matter of fact, I've never been among anything that I've went to that later on found out that there was a terrible breakout. So I respect the mask.
But do you believe they work?
I don't know. I have not seen conclusive evidence to suggest that they work.
So the capital correction for Senator Bailey coming from this study from 9 eye doctors and medical doctors in Virginia, Canada, and Poland, who reviewed 198 countries and found generally the places that encouraged mask wearing had lower rates of death. But studies get more specific still. Researchers from the International Journal of Nursing Studies ran 19 randomized controlled clinical studies and found wearing a mask was an effective way to prevent a sick patient from passing COVID-19 to a healthy person. It gets more specific still. This study, published in the Journal of the American Medical Association, cited by the Centers for Disease Control, found that people who don't even know they're sick yet can still spread COVID-19. And yes, wearing a mask can help to reduce the spread of their droplets into the air or onto the skin of other people near them. This study from researchers at Duke University went farther still and found that the N95 mask was the safest of all of those options out there. But even if 95% of the people would wear a cloth mask, a less safe option, when they're within 6 feet of other people out in public, it will still reduce the transmission of COVID-19 by at least 30%. For Capital Connection, I'm Mark Maxwell.